Okay, I'm preparing to give my patient their 9 a.m. medication for today. So before I enter the medication room, I want to go ahead and perform hand hygiene. I enter into the medication room and I want to confirm that I do have my patient, Linda Belcher, born September 4th, 1972. I do show that the physician did order for the patient to take Coumadin 5 milligram PO daily for their atrial fibrillation. I do show that against the MAR that the pharmacy did also confirm the order of the Coumadin 5 milligram for the patient to take orally for the patient's atrial fibrillation. I do want to confirm that on the MAR it does also show the patient's date of birth of September 4th, 1972. I also want to confirm that as listed that our patient has no known allergies. So as I'm looking, I do want to confirm also the MRN number. So in order to do that, I have to pull out the medication. I do show that we do have the 5 milligram for the Coumadin. We have the generic version of the warfarin. In order to confirm that I can safely administer this to our patient, I need to confirm that the expiration date is accurate. And on this, I show that it expires March 2040, which is perfect for us to administer. I'm going to go ahead and scan that and check that out of the Pyxis. And so we have the MRN number listed on there. And so now I'm going to prepare that I am going to administer the medication to our patient. Currently, the time is 8:45 a.m. and the patient is due for a 9 a.m. dose of the Coumadin 5 milligram. I am now preparing to go to our patient's room to administer the medication for them. So I'm on my rolling cart in front of the patient's room. I am then going to again confirm that I have the right medication for our patient, Linda Belcher, born September 4th, 1972. This patient has no known allergies. It is for the Coumadin 5 milligram taking daily orally for the patient's atrial fibrillation, the atrial fibrillation, the AFib. And on this, I do also show that I do have the right medication. I have it for Coumadin 5 milligram. We do have the warfarin here. And I do also show that I've already checked the expiration date. So now I'm preparing to enter into the patient's room.
Come in.
Okay, so I'm preparing to enter into the patient's room. Good morning. Hi, I'm Tamika. I'm your morning nurse. I'm here to give you your medication that's due at 9 a.m. How are you doing today?
Good.
That's good. If you don't mind, can I have you to verify your name and date of birth?
My name is Linda Belcher. I'm born September 9th, 1972.
Okay, so can you confirm one more time your date of birth for me? Just check it one more time.
September 4th, 1972.
All right, perfect. Thank you so very much. If you don't mind, can I take a look at your medical band? Perfect. Thank you. And get that scan there for you. I'll show that we don't have any allergy band on your wrist. I confirmed that I did scan it in the system. It does pull up that we are confirming for patient Linda Belcher. Okay, so Ms. Belcher, do you happen to have any known allergies?
No.
Okay, so no allergies to medication. The medication it shows that I'm to give you today is for your Coumadin. It's a Coumadin 5 milligram tablet. It's for your atrial fibrillation for your heart. Have you ever taken this medication before?
Yes.
Yes, so you're familiar with this medication?
Yes.
Okay, perfect. So even though you're familiar with the medication, I do want to be able to let you know what to expect about it. I have to give you this information every time we administer the medication to our patients, okay? So I just want to let you know in administering the medication, the Coumadin for you, you should expect, you can possibly expect some light bleeding. So it does cause bleeding in the gums. It could also cause bruising, fatigue, and some weakness. And you may notice some discoloration, like a darkening in your urine. And if you happen to notice any pink in your urine, let me know too. You may also notice that your skin may turn a bit a different color. It may turn jaundice, like a yellow skin color. If you do notice any of these symptoms, just let me know, okay? Okay, perfect. So I am getting ready to give you the medication. Before I administer the medication to you, and if you don't mind, may I have you to drink a little bit of water just to make sure you're swallowing okay today, okay?
Okay.
All right, perfect. You seem to be swallowing fine. So I'm going to prepare your medication for you. Open the medication in front of the patient. And put it in there. Okay. And so here is your medication, Miss Belcher. And then I'm going to follow that up with some water. Thank you. And then I'll take that from you. Okay, and if you don't mind, can I have you open your mouth a little bit just to make sure it went down good? Perfect. It went down great. Okay, so I am going to confirm. So if you have to use the restroom or if you feel like you need to get up or anything, just go ahead and let me know. And I will come in and help you. And the way you will do that is through your call light right here. I'm going to give you your call light. So if you need to use the restroom or anything like that, let me know, because again, I don't want you to have some fatigue to get out the bed and then accidentally may have an accident and cause some bruising or anything, okay? Because this medication, again, because it is a blood thinner, it may cause you to bleed or bruise easily, okay? Okay. Is there anything I can do for you? You need any extra pillows, anything like that?
I'm good.
You're good? Okay, perfect. So if you need me, you can use that call light, and I will be in to check on you later, okay?
Okay.
All right, you have a good day. Thank you, Miss Belcher.
You too.
Thank you. Okay. Before I exit the patient's room, perform hand hygiene. Okay. Exit the patient's room, close the door, and now I'm going to prepare to document into the EMR system. So I'm going to document that I was able to successfully administer the Coumadin 5 milligram daily for our patient, Linda Belcher, who was born September 4th, 1972. There was no complications. The patient did handle it very well and was well aware of any potential side effects. And if the system is down, if our EMR system is down, that was the case, I would draw a line through the medication and put my initials on it. Okay, that's it.